Hi, Dr. Miller. We want to welcome you here. This is Steve Healy from the Brooke Healy Foundation in New Jersey. My daughter Brooke actually was treated at Memorial Sloan Kettering. So, on behalf of the DIPG DMG Collaborative, we have some other people here that want to talk to you. I just want to jump right in and say that we want to talk about your grant for CSF cell free tumor DNA liquid biopsies for pediatric brain tumors. You requested a grant for $100,000, and we want to congratulate you because we're awarding you with that grant.
Oh, thank you guys so much. I'm really honored. And whatever I can do. And actually, DIPG and diffuse midline gliomas now are a huge focus of my work. So I'm hoping to be able to do better for
Well,
everyone. But
we're certainly proud to have you be a part of it, and we do have some other members of the DIPG DMG collaborative. So I'm going to introduce Gina Keller right now.
hey, nice to meet you, and thank you guys for meeting today on such short notice. I actually just came back from maternity leave, so I just had a very, very busy clinic yesterday. So thanks for accommodating this today.
Well, that's wonderful. Dr. Miller, I'm Gina Keller, the chapter director for Hearts for MK. We're out of Austin, Texas. And I just want to say congratulations on receiving this grant. The work that Memorial Sloan Kettering has done and continues to do is so encouraging. And I wanted to share that our daughter, Mary Catherine, who's pictured behind me, was a patient of Dr. Mark Swedane and Dr. Kim Kramer.
Oh,
We love both of those doctors, and we just appreciate the important work that you continue to do there. So thank you so much. Congratulations. And now I'd like to introduce Bonnie Corcoran.
well, thanks for saying that. And I know both of them very well. Mark and I are directly collaborating on a lot of this work. So
He's amazing.
he is definitely very inspirational. So as is Dr. Kramer. So
Hi, I'm Bonnie Corcoran with Brenna Strong in Maryland.
yeah.
Congratulations on getting your grant. And this is a new way to diagnose tumors. And thank you for paving a way for that and for pioneering this trial.
Oh, well, thank you so much.
you.
Thank you so much for saying that.
I'm going to introduce Irvine from Abby's Corner.
Great.
Hi, Dr. Miller, Irvine here, a representative of Abby's Corner, and also we are really excited to be part of the DIPG and DMG collaborative. It's been really amazing to hear about the great work that's being done. I want to leave you with this question. So how can this opportunity of liquid biopsy of tumors change what we currently know about brain cancers?
Can I answer you?
Yes.
So I think, liquid biopsy has great potential for several things, as hopefully I got across in my writing. So I think, in terms of diagnosis, we're getting very close. I think we feel pretty confident that if the genomics match the clinical and radiographical picture, that we feel confident that we can make a diagnosis through a liquid biopsy at this time in many, many cases, which is very exciting to be there, especially in situations where biopsy is not advisable. I think the work that really needs to be done is understanding what detection of ctDNA in the CSF means for patients. So if we detect circulating tumor DNA before we see a change on an MRI scan, is that predictive that a change on an MRI scan is going to happen? Can we monitor children non-invasively through liquid biopsy and detect, disease recurrence earlier? So that's one huge direction that we're trying to go in. And with this work in particular, we're going to now be able to look across 17 different centers through this big consortium-based study, which is really exciting, and look at CSF samples obtained at different stages of disease to look at how directly it's correlating radiographically. The other thing that we're hoping to understand and learn is how tumors evolve and change. For example, diffuse midline gliomas over time pick up additional alterations in different growth factor signaling pathways. And we need to understand those changes better because, of course, children with DMGs usually get a biopsy at the beginning, not even always, and we usually don't have samples from later in the course of their disease. So this is going to help us identify the ways in which those tumors are evolving and changing over time.
Thank you for that synopsis. Once again, congratulations. We're super excited to be working with you, and we can't wait to see your findings. Thank you.
Well, thank you all so much for your trust and support of this work and in me